Ovarian cancer is the fifth most common cause of cancer-related mortality in women. Here to tell us about the risk factors and what we need to look for is Dr. Javier Pineda with Ironwood Cancer and Research Center. Doctor, great to see you. Thank you for coming in.
Likewise, thanks for having me.
This is so important for every woman to pay attention to this because we hear about ovarian cancer, but what is it?
Yeah, that's a really important question because you're right. I think we hear about it enough, but we don't know enough about ovarian cancer to understand. So ovarian cancer is cancer that begins in the ovaries. But what we've recently learned is that a subset of what we used to think of as ovarian cancer actually also begin in the fallopian tubes.
Okay, so when it comes to ovarian cancer, why is it so difficult for someone to get screened to determine if they have it?
Yeah, the goal of screening for ovarian cancer is to identify a mass that's growing in the structures of the ovary and fallopian tube, which are located in the pelvis. The goal would be to identify ovarian cancer at a localized and more potentially curable stage, and therefore decrease the risk of a woman dying from ovarian cancer.
So how is ovarian cancer diagnosed?
I think, first of all, we need to have ovarian cancer as a possibility in our thought process. If we're not thinking about ovarian cancer, we're not going to diagnose it. Women need to be aware of their body, and they need to be paying attention to the symptoms that are common in patients with ovarian cancer.
So what are some of those symptoms?
Yeah, so I want people to think about abdominal pelvic pain, distension in your abdomen, bloating, changes in your bowel habits, feeling full faster, difficulty eating, problems with your bladder, going to the bathroom more often, having urgency to empty your bladder, especially if these symptoms are new and happening very frequently. About 12 times a month is what ovarian cancer patients report.
So women really need to pay attention to their body, go to their doctor. What are some of the risk factors for the development of ovarian cancer?
Yeah, I think people need to be aware that people have an increased risk for ovarian cancer compared to the population at large if you have difficulty getting pregnant, have a diagnosis of endometriosis, which is when the inner lining of the uterus tissue is found somewhere else in your body. People that have a family history of breast, ovarian, uterine, colon cancer. There are two genetic predisposition syndromes I think people need to be really aware of. These are the hereditary breast and ovarian cancer syndromes, which include patients with deleterious mutations in the BRCA1 and 2 genes, and then Lynch syndrome. More common cancers than ovarian cancer and Lynch syndrome include uterine cancer and colorectal cancers. The importance of these is these patients develop ovarian cancer at a much younger age than the average woman. The average woman that develops ovarian cancer is about 60 or 70 years old.
Okay.
These women develop cancer earlier, but we can prevent it if they can get to their doctors and have prophylactic removal of their tubes and ovaries, and for the right patient, consider removal of the uterus as well.
So for a woman who is diagnosed with ovarian cancer, how is it treated?
Yeah, treatment always begins with a combination of surgery and chemotherapy. You should always be treated on a team that has an experienced oncologist and, in general, an experienced gynecologic oncologist. That team member will be able to identify which of the two modalities should go first. If you undergo surgery, which is the most common route, the diagnosis actually is going to be made at the initial surgery. Sadly, at that time, about 70% of women already have disease spread in their upper abdomen.
Wow.
Yeah. If chemotherapy is the route that's selected first, it's confirmed on a biopsy before you start your chemotherapy.
But you were saying if women catch this early, they need to be vigilant for their own health care, go to their doctors and say, I'm seeing these symptoms, I'm feeling them. If it's treated early, it's very treatable.
If it's caught early enough, that's the goal, is that we can decrease the number of women who die from ovarian cancer. But we have to be thinking about it. Women have to recognize these symptoms in their bodies and be persistent, be self-advocates for themselves and their loved ones.
And you have centers or locations across the valley. No matter where you live, a woman can go to you and they can get the answers that they need.
And that's really, really important. I think Ironwood, we treat ovarian cancer and all cancers on a multidisciplinary team. We have GYN oncologists, medical oncologists, nursing, social work, nutrition, and genetic counseling. All of them work together to make sure we get the best possible outcomes for our patients.
Doctor, thank you so much. It's such an important topic that we women really need to take control of our own health care. So thank you for coming in. And if you'd like to learn more about Ironwood Cancer and Research Center, you can visit their website, ironwoodcrc.com, or call the number you see right there on your screen.